Hi, I'm Dr. Nicholas Abidi. I'm a board-certified orthopedic surgeon. I specialize in problems of the lower extremity, so I focus on the hip, the knee, and the ankle, both chronic diseases as well as acute trauma and sports-related injuries. My great days in the office are interacting with patients and talking to them and getting to meet them and know them. I chose to practice community orthopedics and not an academic center anymore because I actually like to make a connection with my patients individually and know where they're from and what they do and how many years they've been in the community. And so I see patients in the office 2.5 days a week, and I operate 2.5 days a week. And we do a wide variety of standard cases and extremely challenging cases in our facilities around the Bay Area. We involve all patients with decision making by finding out, number one, what their family needs are. If they have a spouse they want to talk to bounce things off of, we'd be happy to talk to them. But then we make sure they understand the process of the care. And by looking at that educational process over time, you'll generally understand things a little bit better and be more willing to go through the process and generally get better. If you have problems with the hip, the knee, or the ankle, we'll be happy to see you and take care of you, be it acute injury like a hip fracture, a knee fracture, an ankle fracture, or chronic ongoing problems that are difficult to solve. But whatever your problem is for the lower extremity, I'm honored to take care of you and look forward to seeing you in our office.